53-year-old David Matthew and 4-year-old Lida Chia are 2 generations apart. David lives in Singapore, while Lida is from Cambodia. Despite their separate lives and vast age gap, they shared a common ordeal. They once battled with life-threatening leukemia, a type of blood cancer that afflicts adults and children.
Always the first reaction as a human being is, why me? Then I always think that, hey, there's nothing wrong with my family. If you look at the family history or family tree, there's no one has got leukemia. Haven't heard about it. I'm the only sole breadwinner in the family. You always think about what will happen to your family. This was my main concern.
这种病，别的孩子、别的妈妈看来也不是喜欢自己的女儿生这种病的。如果他可以代替，他就可以代替。我们吃很多苦，尽量不想讲出来，这样很难，因为看到自己的女儿小小这样生这种病，真的很难。
More than 800 Singaporeans are diagnosed with blood-related cancers, including leukemia, every year. This means there are more than 2 blood cancer cases every day. The journeys of Lida and David are inspiring stories of survival, of how advances in medical science offer them new hope in the fight against cancer. David is a doting father who enjoys spending time with his family. This is also the man whose world nearly collapsed in 2011. David was 49 when he contracted acute myeloid leukemia.
I used to feel like vomiting. Then I used to get tired very fast. So after my dinner, I used to just go for walks or walk around the estate. And then I thought maybe because I was a bit of dieting or something, so it is maybe because I'm too much of dieting that this particular symptom is coming.
There are 3 types of blood cancers. Leukemia is the most common among them. Within leukemia itself, the acute types spread much faster than the chronic ones. All blood cancers start at this part of our body, the bone marrow. The bone marrow is our blood factory. It produces stem cells that develop into blood comprising red and white blood cells and platelets. To produce healthy white blood cells, stem cells need the help of other cells called blasts. But when blast cells develop into deformed white blood cells instead of normal ones, they crowd out the healthy cells in the bone marrow. This causes leukemia.
In leukemia, what happens is that the white cells are cancerous cells. And these are cells which, with time, start developing and growing in a very rogue manner. One of the things these cancer cells do is that they find ways to evade the immune system of the patient so that they can keep growing. That's the reason why the patient cells cannot actually recognize these cancer cells.
Some leukemia patients fail to respond to standard intensive chemotherapy. They would then have to rely on a bone marrow transplant. There are 2 treatment options. Patients can use their own stem cells through a process called autologous treatment. Or they can find a match through a donor's stem cells called allogenic transplant. Unfortunately for David, the option of using his own stem cells will be ineffective.
If we were to take the patient's own cells, harvest them and give them back to the patient, there's a high chance that these cells will still not be effective in curing the leukemia. On the other hand, if we can get cells from a donor, either from a family member or from a donor from one of the international registries, we're relying on the fact that these cells do not really completely recognize the patient's leukemia cells and might be able to provide a strong what we call an immune reaction to clear these leukemia cells.
David has two ways of finding a stem cell donor: to look for an unrelated donor or to find someone within his family for a match. For an unrelated donor, he could turn to the Bone Marrow Donors Program to find a perfect match. But his chance appeared slim. The Indians comprise just 8% of the pool in the Singapore's donor registry.
You have a higher chance of finding a donor if you have a larger ethnic pool, but sometimes we do find a donor which is outside of a patient's ethnic group. So for example, sometimes we can actually find a donor who is Indian who actually matches one of our Chinese donors. So it's having a large ethnic pool helps certainly finding donors, particularly for our ethnic minorities, but it's not an absolute need.
David's first choice is to turn to his brother, since there is a possibility for patients to find a full match among siblings. This is because each pair of genetic markers in our white blood cells is inherited from each parent. Still, David has no luck. His only sibling's stem cells did not match his.
My doctor always says, if you are willing, then anything is possible. So I think at the end of the day, it's the patient who has to decide, or who has to look forward, who has to have the ability to fight and look forward. Then of course you have the family. And of course at the end of the day, doctor always says, yeah, I'm the last person. I can only treat you with medicine. It's up to you to survive this.
David finally found hope through the advances of medical science. In the last decade, doctors worldwide have refined a method which increases a leukemia patient's survival chance tremendously. The process is called haploidentical transplant. It has been used by doctors in Singapore in the last 5 to 8 years. Unlike the conventional methods, this new process needs only half a match for the treatment to work. With no solution from the donor bank nor his family, this was David's next best alternative. For David, who had tried all means, a haploidentical transplant gave him hope for a new lease of life.
When you're using a donor who has a large degree of mismatch, up to 50% mismatch, the big risks are that the donor cells and the patient cells will fight during a transplant. And when they fight, there are two potential outcomes. One thing we want to avoid is what we call rejection, where the patient cells will push away the donor cells. On the other hand, what we also want to avoid is the donor cells becoming too active and turning around and attacking the patient cells, again because it's a 50% mismatch. Why internationally we're able to push forward with haploidentical transplants over the last 5 to 8 years now is because the new techniques are involving use of better drugs, better understanding the type of drugs that we can use to prevent both the donor and recipient fighting, as well as better understanding of how we time our drugs to prevent this fighting happening.
Since children inherit half of their parents' DNA, David's eldest son, Daniel, became his lifeline. His daughter, who was merely 15 years old in 2011, was considered underage as a donor.
So around in October 2011, my mom told me I could be a donor for my dad. So I thought it's not real, it's not going to happen because she was just telling me in passing. But afterwards, when they realized that I was the last hope, they came out to me and they told me about it. So my dad was like, just do it if you want to do it. So I was straight away, I was like, I'll do it. It's my dad. He brought me up, provided for me, he loved me, took care of me. This is the least I could do to pay him back for what he has done for me for the past 17 years.
But the fight against leukemia was still not all smooth sailing for David. His haploidentical transplant began with the harvesting of his son Daniel's cells. A series of drugs were injected into the donor's body to induce the production of more stem cells. This process is somewhat similar to the concept of dialysis. A machine was used to separate the stem cells from the blood. While the blood was returned to his son, the harvested cells were immediately transplanted into David's body.
So with a stem cell harvest, the number of stem cells we're actually taking from a donor is only around 2 to 3% of the total pool of stem cells. So we're taking a relatively small amount of stem cells when we're harvesting them. Yeah? And these stem cells actually get regenerated and they get regrown very quickly. So even after we harvest this amount of stem cells from a patient, within 3 to 4 weeks, most of these cells are replaced in the patient's bone marrow.
As with every transplant, patients are prone to contracting infections due to their body's low immunity level. For the bone marrow transplant, 3 in 10 patients have experienced an initial cell rejection from its donor despite the match. This is known as the graft versus host effect, a condition that David experienced while undergoing transplant.
8 months I was in the hospital, and suddenly my whole skin got affected. My face became very dark, my lips got swollen, and then I had some urinary problem. Then I had to go for circumcision. At the end of the day, there's not a single department in the hospital which I didn't go through.
Graft versus host disease is one of the more complicated side effects which can happen after a transplant, because when this happens, the donor cells can turn around and attack a variety of organs in the patient. So it can cause problems such as gastrointestinal problems. So patients can have diarrhea, can affect the skin, or can affect the liver. So the main ways in which we can try to control this side effect when it happens is by giving medications to dampen down the immune system. We give the patients what we call anti-rejection drugs, either in the form of tablets or injections to dampen down the immune system.
David had to take anti-rejection drugs to suppress his immune system during the treatment. Soon, his body gradually accepted the donor cells. His leukemia was in remission 8 months after diagnosis. He finally pulled through his ordeal.
We become a close-knit family. I presume that we are more loving with each other. I value my life now. Earlier I used to take a lot of tensions. Work tension, this tension, that tension, children, how they... But nowadays I do not do that. This is beyond my control. It's no use worrying about certain things because I have gone to the brink of death and I came back. So I don't have to worry about all these small things about it. Let nature take its own path.
We always say within the first year of the transplant and that during that recovery period, we have to keep a very close eye on the patients because they are still a very high risk of infections. They also have a very high risk of problems such as including the leukemia potentially re-emerging. So patients have to be under very close surveillance for the first year. I mean, the best case scenario, obviously, ideally, a patient gets their stem cells, they recover within 2 to 3 weeks, and they get discharged from hospital. And if they don't have any complications, in the best case scenario, we've had cases where patients are back to work or to school within the several months afterwards.
For Lida, the fight against the deadly disease was equally challenging. After attempting to seek medical treatment in a few countries, doctors were still unable to identify the cause of Lida's condition. Children aged 5 and below are the most vulnerable. They're the largest group among child cancer patients every year. Lida was just 19 months when she was diagnosed with a rare type of blood disorder in 2012. It's called juvenile myelomonocytic leukemia, a chronic leukemia which spreads slowly and does not respond well to chemotherapy. A year after Lida was born, her eyes began to protrude. The cancer had spread to the back of her eye sockets in her head. She could turn blind and even die if she did not undergo a bone marrow transplant.
Children have no issue to go for transplant so long as they have a donor for the transplant. And obviously the physical condition of the body is reasonably stable to go for a heavy treatment like transplant. They are both myths and realities that family will be concerned with. The most common myth is that children are too small to go for transplant, which is not true. In reality, children actually stand transplant treatment much better than adult patients.
But in order to undergo treatment, Lida must first find her perfect stem cell match. The situation soon grew desperate when none of the bone marrow stem cells from her two siblings matched hers.
我的心都很脆了，要掉下来了。几个兄弟自己同胞生出来，全部都不可以帮着这个妹妹，也很难。我尽量告诉医生，帮他找适合的骨髓，帮他医疗了。玩多少钱我都可以付。我家人自己都没有能力帮他，只是靠别人帮了。
Since every cell is encoded with its own genetic markers, the process of finding a perfect match for leukemia patients is extremely difficult.
We have a pair of antigens in our body, one from our father and the other from our mother, and these are all inherited. So by chance, any other sibling would have a 25% chance of getting the same pair of antigen from the father and the mother. Obviously, the more siblings you have, the higher the chance you will get a donor. But by chance, you can never have 100%. A half-matched parents is one of the options we consider. The other option is to look for unrelated donor from the worldwide registry of donors.
Fortunately, Singapore's Bone Marrow Donors Program is a member of the Bone Marrow Donors Worldwide. Leukemia patients here are able to expand their donor search through this international network that covers more than 48 countries.
So from the day we receive the request to tracking somebody down could be on average around 3 weeks, 3 to 4 weeks. Because again, it's a database search, so we find that very quickly, that's almost immediate. But then we've got to send a letter in some countries.
Although the waiting time for that perfect match is on average about a month, the uncertainty can be emotionally draining. For Lida's case, the wait took up to 2 months.
医生说我女儿不可以等太久了，每个礼拜都有打，说可以找到了吗？医生说还没找到，人家还没答复，再给我们等几天吧。我再等1天，像等10天这样，10天像等10年，心里都很难，吃不了东西，那期间等很辛苦。
Finally, good news arrived in May 2013. The stem cells harvested from an umbilical cord in Taiwan matched Lida's perfectly.
我感受也很开心，也很担心。在那段的期间，如果配得好没关系，配不好就很难。医生说还可以啦，配对就很开心，也要好好的照顾他了，配对。
The cells from Taiwan had to be transported to Singapore before treatment can take place.
I think the first hurdle is getting to the airport and making sure that we get through security without having to put the product through the X-ray machine. So even if we have to unpack the product to show it, we don't X-ray it. We must never do that.
Before the infusion process begins, the white blood cells need to be separated from the cord blood. Tests are then made to ensure there are enough stem cells in the collected white blood cells for the patient. Harvesting stem cells from the umbilical cord is one of the newer options that benefited many leukemia patients in recent years. So precious are the tissues found in cord blood that doctors regard them as gold.
In terms of the transplant outcome, cord blood and bone marrow transplantation are actually quite comparable. They have different risks and benefits. So in terms of recovery, bone marrow transplant tend to be faster in terms of blood cell recovery. But in terms of complications like graft versus host disease, where the stem cell reacts against the recipients, cord blood transplant tend to be safer and less. So when we balance out the risks and benefits, the outcome turned out to be quite similar for these two types of transplantation.
Although the search for matching stem cells can take months, the infusion of stem cells into the patient's body takes only a day. Once the stem cells are thawed at 40 degrees Celsius, they are injected into the patient. Treating young patients for life-threatening diseases can be tricky since their ability to communicate with doctors is limited. But there are clinical ways to find out whether the treatment is working for the child patient.
When we are treating children with serious illnesses, we always look for behavioral symptoms and signs to see if they are well or not well. When a child is well, they will smile to you, walk to you, or play around in office. They will be cheerful, they eat well, they talk well. But when they are not well, they will be hiding in their mommy's arms. They will stop talking, some of them will stop feeding. But it's important to get the diagnosis early. Like infection, if you can treat infection early, the child's recovery is actually fast and the time they spend in hospital will be less.
Bone marrow treatment has one of the greatest success rates. The survival rate can be as high as 90%. It has been 2 years since Lida underwent treatment in 2013. She still has to go for regular checkups at the hospital to ensure her bone marrow continues to produce healthy stem cells. The future of leukemia treatment is still evolving with bright promises. Next week, we'll show you how tumors can be destroyed with radiation therapy. This eliminates the need for open surgery. Another cutting-edge treatment for cancer patients.